In 2016, AIDSFree started supporting two organizations, namely Lesotho Network of AIDS Service Organizations and Lesotho Network of People Living with HIV or AIDS, to receive technical assistance in order to contribute to the government of Lesotho and PEPFAR's efforts in attaining the 90-90-90 targets. This support came based on USAID Lesotho's request for technical assistance to strengthen HIV programming with a view to increase the uptake of pediatric and adolescent HIV services as well as PMT-CT. In 2018, AIDSFree expanded its focus to support improving linkages to health care of female sex workers and the LGBTI community by providing technical assistance to Care for Basotho and Matrix as organizations working with these key populations. AIDSFree also supported the National AIDS Commission to strengthen its coordination role to the CSOs working with HIV and AIDS in order to contribute towards the achievement of the 90-90-90 targets. Among others, the National AIDS Commission is responsible to coordinate CSOs to ensure they advocate collectively on HIV issues, getting updates on technical issues, and to share experiences and learn from other stakeholders.
We had a training for our civil society organizations where they were trained on updated information about HIV, the new developments in HIV testing, like self-testing, index testing, partner notification, and others. And we have also been given HR support. AIDSFree has deployed a civil society coordinator who is based here. We have had him since June. He has been tremendous in ensuring that all the things I have reported on are executed properly. We have also had media training where we engaged a lot of different media houses, both print and audio in Lesotho. They were trained to provide factual information about HIV.
I got the opportunity to be trained by the Ministry of Health with other my colleagues from different media houses, whereby the training was more on HIV and AIDS, but also we got the opportunity to learn about other diseases that take the opportunity when the person is HIV positive, like cancer and TB. We also had the opportunity of visiting the mobile clinics which are at workplace, and also we went to Mafeting to learn about the PMT-CT, which with it we realized how important it is for the pregnant women to get tested, also to know the children's status.
We feel proud that AIDSFree has come up with tools such as picture cards to assist field workers when creating demand for health services amongst the youth.
Support group ya ka ke tisetsa support group ha ga morakane mona. Ke ka bella segeleng sa lenaso. Lenaso ke yona yentseng re tataisa hore re khothaletse bomme le bontate le bana ho ya ka setsing sa bophelo. Mme ka setsing sa bophelo re khothaletsa hore ho hlahlojwa mafu a latelang ke lefu la mofetshe wa botona ho bontate wa bomme haholoholo re khothaletswa matsweleng le mofetsheng wa popelo.
As the project ends, we are confident that the skills provided to the organizations and the communities will continue to be utilized even after the project is phased out, to encourage communities to utilize available services to ensure the country reaches 95-95-95. The CSOs were capacitated to review existing and establish new policies in areas of human resources, procurement, finance, and governance, and to ensure effective implementation of those policies. This support helps to improve internal systems and will no doubt benefit the CSOs in attracting more resources and in being more accountable in managing those resources.
I would like to take this opportunity to thank AIDSFree. AIDSFree helped Lenaso in various activities. They assisted Lenaso in community engagement, whereby we engaged all the communities in the services that are provided in their communities, where they should access, when and how they should access such services. Lenaso was also capacitated in the area of advocacy and communication. When doing demand creation, we are assisted that we should invite the media, being television, radio, and by doing so we're able to do press release, and then they were able to come to the events. Moving forward in the side of strengthening policies, Lenaso board members were trained in terms of governance, whereby they were helped to strengthen the policies that are run within Lenaso.
AIDSFree started its support to LENEPO in 2016. The assessments were conducted and gaps identified. The gaps which are identified related to a community engagement. They related to advocacy and communication for people living with HIV. Also community mobilization, especially mobilization of men and youth to access health services. AIDSFree supported us to develop and strengthen our internal management systems, and this included HR policies, procurement policies, finance policies, M&E, and governance. The impact of this collaboration has been seen during the USAID assessments which were conducted recently, where all the required management and procedures were available when they were required.
AIDSFree has supported our organization in providing trainings to us as the project staff on advocacy communication, and also on issues of performance management. The performance management was specifically to train our board members so that they would have skills on how to run the organization. And again, for the organization, as for CDA as an organization, AIDSFree have also supported us on reviewing our policies. Like we all know that every organization should have policies.
I would like to take this opportunity to thank AIDSFree for the great support to our organization on areas of organizational development. The trainings they offered to our team on finance and procurement, human resource, and M&E, and also the great support that they showed to the organization on leadership strengthening, specifically on our executive committee, where our executive committee was trained on governance and leadership. And again, the additional human resource was a great support to us in strengthening our HIV MSMTG program, on which the additional personnel was able to review the manuals and also support the organization to undertake its advocacy outreaches to LGBTI community, bringing together also the stakeholders, the relevant stakeholders from Mafding and Maseru.
We are proud to say, as AIDSFree, we developed capacities of civil society organizations. They were able to develop advocacy and communication plans. They were able to improve the human resource, procurement, governance, and finance policies. And we are comfortable that the policies will be implemented to meet the donor demands. And with that capacity, they will be able to attract more resources, and they will be more accountable to their beneficiaries as well as the donors. We are proud that we developed picture cards like this, which is a resource or a tool that is being used at community level to mobilize the adolescents. It has a picture on this side, and these are the key messages that the young people are using to encourage dialogue amongst others, why they are not using health services, why these health services are important for them, And with this, we hope there will be an increased demand amongst adolescents. We also developed this community guide, which is used for the general population, and it has key messages on test and treat, on STI management, on community art groups, on adherence, on viral load. We thank AIDSFree for this support, and we are comfortable and confident that the CSOs will be able to improve their contribution towards the achievement of 1990 targets.
Thank you.
Thank you.
We thank you.
Thank you very much.
We still need a lot of support from AIDSFree. Thank you very much.